So let's start. Could you please tell me a little bit about you and your background?
Yes, I would love to. And it is an honor to be with you. I'm really looking forward to the convention, and I appreciate you interviewing me. So I was born and raised in Germany, but then followed the love of my life to move to the US and went to dental school actually in San Francisco, UCSF, graduated in 2009, and then moved to Florida, where I first associated, but then started my own practice in 2011. And I'd always had an interest in implantology. So I took some extra courses and started diving right in. And I very quickly encountered, within a few weeks, I encountered a patient where she had an upper edentulous arch that we were going to place some implants in, and she had really a lot of really good soft tissue and a good height of bone, but very skinny, which I didn't recognize in the panel. So when we did surgery, I was surprised to see how skinny her ridge was. So I decided just a couple of months into owning my practice to upgrade my panel to a CT scan. So that was very early on in 2011. And then it just took off from there. The practice grew dramatically. I hired some associates. And in 2016, I actually had to move out of the space because we only had 6 ops and we were outgrowing that. So in 2016, we moved into new construction and opened my dream practice. All of this is in Tampa, Florida. And I became credentialed with the AID and then with the ABOI. I got my diplomate in 2019 and limited my practice to implantology. And now I'm in the process of limiting to full arch, which is really where I get the most satisfaction out of patient care. And continue to be a lifelong learner. The most impactful CE, I want to say I took last year was a mini residency in radiology, which was really eye-opening because I always felt like I could read my CT scans, but I wanted to get a little bit better at really catching everything and making sure that I treated the patients to the best of my ability. And so here I am today, and really looking forward to discussing the courses we're going to have at FNDC.
Well, that's really, 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 really amazing. Now, I know you mentioned that in 2011 you have this case of a patient that did not have enough bone. It became kind of like a challenge. And I know by 2011, having a CT scanning in practice was very unique. But lately, have you had any case that maybe had a complication or had created some excitement, something interesting? Almost about, 12, 13 years after that first patient that you have with not enough bone?
Right. So with CT, obviously, you know a lot more about what you're getting into. And forget full arch, even just diagnosing a patient with teeth, right? We all have seen those patients that have unexplained pain where you're thinking maybe it's just bruxism, maybe it's just them, or you're scratching your head a little bit. And we've all seen those cases where on the PAs or two-dimensional x-rays, you don't really see much, but then you get a CT scan and there are hidden abscesses that are just not seen because the two-dimensional x-rays kind of get an average value. Or diagnosing, CT is so useful for so many disciplines in dentistry, diagnosing the proper position of impacted molars or canines. And so it doesn't eliminate surprises and complications, but it really, really minimizes them. So, I was thinking about complications, and there are plenty of complications we always encounter, right? I don't care how good you are. There's always something that can go wrong, right? But it's very much more of an excitement with care. So lots of people have bad teeth and need teeth replaced, or they just don't make them, right? There are those that have congenitally missing laterals, and that's super exciting to not have to wear a flipper or something to replace those teeth. And we have other options like bonded Maryland bridges, but sometimes that's not a good option. So implantology can be very rewarding. A case that really stood out recently, though, was Haley. Haley is a young lady that came in with having missed already several molars at age 23, which is very young to be missing several teeth already, but severe crowding in the anterior. And Haley presented with teeth that were so covered in plaque, she could only really eat mashed potatoes that were lukewarm because she had a lot of pain in her mouth. But she had more than just pain in her mouth. When she presented, she was this really scared young little girl that could barely open for x-rays. It was really difficult to even diagnose her. And of course, my first thought was, let's repair what's in her mouth, let's fix her teeth. But after a thorough exam, we realized we really couldn't save anything. She needed full edentulation, and that just breaks your heart when a young woman like that is in a situation where she has to lose all of her teeth. And she was actually the girlfriend of a son of one of my receptionists, and she had no financial means to do anything, not even afford extractions and dentures. And so my receptionist said she would pay for it, which made me aware of how important it was for her to get it done. So I decided to take on the case as a pro bono case. And so I gave her upper lower implants and fixed implant bridges. And after we treated Haley, I got the real story of how she really got there, because she opened up to me. Haley was had a rough childhood. Her parents divorced at age 4, and so her dad kind of left. And then at age 14, her mom told her she was going to go to the grocery store, and she never came back. And Haley at that time had a 4-year-old little sister. So she had to somehow, as a 14-year-old, figure out how to handle life. And she hid it from the authorities for a few weeks, and even just called her school and said, I can't come to school right now because my parents aren't coming home and I have to take care of my little sister. So she had a really, really rough life. And I didn't even know this going into it. Now, when Haley came back, just for the 1 week, we saw her the 24-hour post-op check, but for the 1 week post-op check, oh my God, you wouldn't have recognized her. She came in smiling with confidence. She had the fact that her teeth were so bad had really kind of imprisoned her a little bit. And she came in, and seriously, it was a different person. She was excited. She was outgoing. Her real character came through. And, you can't make these stories up. When I heard her story, I literally broke down crying with her because I could feel the pain that she had gone through. And think about this. As dentists, we have this incredible skill, this gift that we can give to others that they cannot help themselves with, because Haley was really stuck in her situation, right? Like, she couldn't do anything about her teeth, and she was in pain also. And when she did the new patient exam, she said to me, all I want to do is eat a donut. And so, usually people say, I want to eat a steak, because they feel like steak is hard to eat. But she couldn't even eat the sugar because she was just so the caries was so deep that she had so much infection, which is why we couldn't save them. So I recognized, some people really struggle deep and hard, and we don't know this when they come in, but we can help them. And that is just so rewarding. I am so excited for her, because now she's actually thinking about college. She's thinking about different jobs. Her whole life opened up. And that just warms my heart. It's been just really fantastic seeing her grow. It's been 6 months, and man, she's got a bright future ahead of her.
Well, this only tells about not only you being a phenomenal dentist, but having a huge heart.
Well, and it's our obligation too, right? Like
I agree.
usually we're very well off as a profession. We're the top % earners of United States citizens, which is already at the top of the pile, right? So giving back is super important. I make a point of at least doing a couple of cases a year of those. And then we also do a free dental day, but then we can't offer advanced care. We offer fillings and extractions, but I feel like we have a real obligation to, run a business, of course, and be profitable, but then also to think about those who have just had rough times,
Correct. Well, that's an amazing story, and thank you so much for sharing that with us. Now, moving a little bit forward, with digital technology on the rise, what do you see in store for the future of dental implants?
Yeah, so super exciting topic. I love my digital toys. As like investing in NCT in 2011 was kind of scary, actually, because I had I was still a recent grad. I had plenty of student debt. I had opened a practice. I had plenty of practice loans. But I remember that time when I came home after that, not being able to do that surgery because I opened it up and the bone was just too skinny. You know, I couldn't do anything. I came home that night and complained to my husband about how I felt really awful for giving the patient the hope that we could do this and feeling like I could confidently diagnose. And so he said, you know, like, would you be a better dentist if you had CT? And I answered to him, well, yeah, but, you know, and then I came up with a bunch of reasons to wait, right? Wait until some more student debt was paid off or practice debt was paid off, or I was better at implants and stuff like that. But all he listened to was the yes. So he stopped listening after that. My husband has somewhat selective hearing. And so before I knew it, 2 weeks later, the CT scan was just getting installed. He had the vision of technology making us better and making a better patient experience. It really is a win-win. So I saw that and I recognized that. And actually, the CT became kind of a profit center from day one, which surprised me because I always offered a free consult with a free CT. And then when patients saw the technology and saw how we were prepared, and it really establishes you as an authority, they would sign up for treatment. And I always take a CT after implant placement. So I quote the patients for that. And I think back in 2011, it was like $375, and now it's like $450. It hasn't gone up tremendously, but nobody argues you on that fee. And while insurance companies are starting to pick it up now, back then, I always said this is all fee for service. And there isn't really an argument there. So it actually enabled care and it paid for itself. Now, not all technology is like that, but most dentists at this point have digital X-ray technology, right? And often they actually have a scanner. Now, not every scanner is created equal, but they've also really advanced over the last 5-10 years. It's been an incredible evolution. And the prices are really coming down. What I'm excited about is that there are newer scanners on the market that are affordable, that also image soft tissue really well. So for dentures or for, you know, crowns, of course, and bridges, but full arch is really fully digital now. And so while that's a basic technology that I would expect in most dental offices, we now also have advanced technology that really makes care great to approach in office. For example, printing. Printing technology has advanced dramatically. I first started printing all dentures in 2018. So I'm seeing my 5-year follow-ups on these printed dentures, and they are holding up well. Now, when I first saw them, I thought that they were kind of ugly because the pink doesn't look the same as the pressed dentures or the milled dentures with the usual acrylic, the traditional acrylic. But you know what? It lets tissues shine through, and the patients appreciate the aesthetics of it. Actually, the aesthetics have gotten really, really good. And then if you get even more advanced with the full arch care, you know, we have photogrammetry options now that ensure a passive fit and talk about eliminating complications in full arch care. If you have final bridge work that is absolutely passive, there is so much headache that you eliminate with that. So if you have a certain volume, it is an absolute no-brainer to use the technology to really get the accurate information digitally. And what's nice about digital technology is also you store the patient in your files, right? So if something breaks or something is an issue, you can refabricate it. So if after 5 years they want a new denture, you literally just remake the same one, and the patient loves just coming in one time. Or let's say they lose their denture, right? That happens. So instead of having to take new impressions and a new try-in and everything from scratch, you have everything at your fingertips, which is just really fantastic. And the patients also, they receive it so well. They love technology. You know, they just figure, oh, that's how we do it now, right? And it really sets your practice apart as a modern practice. So then word goes around, and then people are like, oh, this is how we do it now. And I think that's a good thing. We need to keep advancing, and we need to keep pushing the limit a little bit and figuring out new ways to treat our patients in a way that we lose the stigma of the dentist. You know, it smells bad, it's painful, and it's expensive. You know, we can lose that stigma a little bit over time. It'll take some time, but we'll get there.
Correct. No, I think I totally agree on that. Now, I think you almost answered my next question, but I still want your thoughts on this one. What do you think is important for dentists to incorporate CBCT and technology into their practice for full arch restorations?
Yeah, for full arch, I think it's just absolutely necessary. It's such an advanced procedure that not having the right tools, it's just not the right thing. I think that a CT scan will, when the prices come down a little bit more, maybe, will just be commonplace like a panel machine, because the radiation exposure is not much higher at all. And the information gained is just a whole nother dimension, right? You
Correct. Yeah,
actually
absolutely,
see
100%.
so much. And like I said, you don't have to be a full arch implantologist to gain benefits from having CT in the office. We still do take pano by default on people who are dentate, because we see the jaw joints better than on our CT scan. It's not the enormous view on our scanner. But even for, like I said, for diagnosing teeth that are still present, or tooth position, if you do a lot of tooth movement, it's really helpful to see things three-dimensionally. And then you can integrate your intraoral scan with it and really plan well. You can make your own surgical guides in-house. There's some workflows that are very smooth these days, and you don't have to invest in the most expensive, biggest, closed system. You can certainly, at this point on the market, find very affordable, really good options that allow you to not invest, a whole nother practice in the technology. And I'm excited to see how the market is evolving, because there are many companies who are competitive and who have good ideas. I am really looking forward to a little bit more advancement in the area of occlusion. That's probably still my biggest pain point when it comes to a full arch care, because it is easy for the patient when we take a bite to kind of go in protrusion. I'm sure all dentists that have done this before see it. You say bite down and the patient does this because they want to show you your chin or something. So I've tried some things in that space, but you have to wear tiaras and hook up the patient, and it's weird, and it doesn't integrate as seamlessly as I want it to be. So I'm hoping that some people who are much smarter than me will put their heads together and come up with some solutions where we can easily get good occlusion into the software. We get it done, but it's still clunky, and I'm looking forward to some advancements there. But yeah, CT technology is an absolute no-brainer. Like I said, it will pay for itself right away. There's really no reason not to invest. Some people still tell me, well, I'm worried if I take a CT scan and I miss something, am I liable? And in the end, well, sure, you shouldn't miss anything. It's important that you don't miss anything. You should read every CT you take properly. But it's the same for the pano and the PAs. And, we see AI coming into the space now, and we're missing a lot of stuff, man. And it's not in the best interest of the patient. So, and it makes sense, right? If let's say in general medicine, I had an issue with my kidneys, I would want a surgeon to really, take the proper imaging, whether it's an MRI or a CT or whatever it is, and I want the proper trained person to look at it. So yeah, you have to get trained and you have to read your CT scans properly. It's not that difficult, because dentists read x-rays all the time, right? So in my course, I will actually go over the proper way to go over it. And you will find that, yeah, you can do that. And no, you won't miss anything. And no, you won't be held liable for finding things on the spine or other things that are accidentally in the scan. That's just a myth out there. People are just worried about.
Correct, but I totally relate. I remember when I bought our first CT scan at Carestream, we were concerned about the field of view,
Sure.
especially because of that. And I think at least in my practice, if there's something that we're not 100% sure, just like you mentioned, we can consult an expert like you. You can also always consult a radiologist,
right?
In case you're something that you're not sure. And then number two, we're working three-dimensional patients, so why limit ourselves to a two-dimension image when you can have a three-dimensional options? And then also, like you mentioned, the long bridge between the clinical aspect of placing the implant and the restorative portion that is so critical and important. So I cannot wait for your course, to be very honest. Just as an attendee. Now, just to finish, Doc, I know you're busy. What are the biggest takeaways a dentist will get from your course at Florida Dental Convention, and why should they attend?
Yeah, yeah. I think it's interesting for dentists to see the current state of technology. What can we really do with what's on the market, and how does it integrate? And also what's possible to do in-house. Before I hired an associate, I actually hired an in-house lab tech because I wanted to have better denture workflows, because I wasn't getting the results that I liked with dentures, because dentures are just as difficult as full arch implants, because you're rebuilding the entire occlusion. If you're good at if you're not good at dentures, but you want to do full arch, well, you had better get good at dentures first, in my opinion. But I'm not going to teach dentures in the course, but I will talk about in-house workflows. I do everything in-house. Well, if people want a metal-based partial, I still have to send that out because we don't cast anything anymore. We got rid of that. But also just getting, for example, the confidence to read CT scans. And then my favorite of the 3 courses is probably the complications course, because I've gotten to that point where I'm comfortable showing my mistakes, and better you learn from my mistakes than not, and I love lectures where they show beautiful outcomes. That's wonderful and inspiring. But at the same time, I might just sit there and go like, well, but what did I really learn, right? Like what difficulty have you overcome? So I always love lectures where doctors show their missteps, and then how to correct them, obviously, and how to salvage, problems that show up. And sometimes it's our mistakes, sometimes it's just what the patient brings in, and being able to recognize what can happen will allow you to prevent issues. And so we all want seamless patient care, and while we can't really always achieve it, we can get close to it. So I hope that people will learn what to do and what not to do, and yeah, and have an open discussion. I look forward also to some feedback. I always enjoy learning from my crowd what's going on, and we have plenty of time. Each session is 3 hours, so we have plenty of time to answer questions and get some input, and I'm really looking forward to it.
Excellent. Well, see, I wasn't wrong. It's such a privilege and honor. Number one, spending some time in private with you. I'm pretty sure we can stay here for hours talking about dentistry.
Absolutely.
I can wait to meet you guys. And again, Doctor, thank you so much for your time. It's been a privilege. It's been an honor. I'm sorry this is the first time I do something like this. I hope it wasn't too boring. And I did okay.
No,
You did fantastic.
Wonderful. Nice to meet you, Dr. Olmos.
It's a pleasure. I can wait to meet you in person. And like you mentioned, not only talk about clinical dentistry, but our convention is full of a lot of entertainment and good food and good parties. And we're hopefully going to have a fantastic 3-day meeting.